后他的毕业要求是口头还是口头？这个就这样吗？
应该都要口头吧？
都是口头。
JCMIT
都是算国际的。
JCMIT 应该没那么严格啦。Okay, I think let's start it. Any question from your current work or previous class material, or any issue you want to discuss before the class? Not yet? Okay. Today, our topic, we will continuing talking about the real, some other institutions experience. Then we will close up those discussion about the other experience. Today, I won't describe too much detail about the LDS hospital experience because they already have some system they already been covered by other in the previous class. So today I will focusing on something new from the LDS hospital. Then I will also they have another set of slides. I want to talking about some EHR modeling issue. Then the next the start from the next week class, we will start to talking about some methodology thing. So we were talking about how to learn the thing from the real data. So we will introduce like the logistic regression, also some data mining technique, those some more traditional statistical way. So from the beginning class to today's class, we were focusing on more like some introduction of the history and some common functionality about the CDS. So now we give you enough example to cover you in the future if you want to write something in your literature or the background section. Those experience and also those reference that would be good for your paper. In the beginning, I will describe the content from this section. Then in later, we will discuss the paper. It's talking about the how to build up the reminder in the ICU. We will talk about the detail about the in the paper. Okay, I think previously we already talked about this HELP. HELP is that's the big name for the electronic health record. The full name for this acronym is the Health Evaluation Through Logical Processing. Then it started very early. I think right now it's more than 30 years. First built up in the LDS hospital. And the interesting thing is the HELP was designed at the beginning, very beginning. Their goal is to provide the decision support and as a research tool, and it's not for administrative. So you can imagine how advanced at their time. We will discuss some component about their each system. You can see they think that their design and their ambitions were very thorough. So the first version is by Dr. Warner. I think the full name is Homer Warner. He is also the Professor Jack Ujran, his advisor at that time. And he already passed away a couple of years ago. at the age 90 something. He's kind of old guy, and he is a cardiologist. And I remember one of his classmates of the Homer Warner, who invented the swan guns. He in our practice, there is a special equipment to measure the cardiac pressure. That thing is called swan guns, and that is invented by the Professor Homer Warner's classmate. So he is a cardiologist. So they use a lot of cardiologists and the intensive unit care system as for building the clinical decision support system. And also the Homer Warner is the pioneer, or the who created the medical informatics program at Utah. So yeah, so for maybe the Homer Warner is kind of the grandfather, or the first guy who invented this area. So I think previously we already showed this architecture. We can see in the center is the electronic health record. So we got the knowledge-based decision support and alert system and all the medical device here. But I'll show you some architecture, but later we will discuss this more. The good thing is until right now, there is no new thing. And I think previously from the partner and from the Regan Street example, they both are similar. They have electronic health record. They got the database to store the logical data. But for in LDS hospital, there's one thing new we didn't cover it before, is they got one thing they was called medical logical module, called MLMS. And later we will have another slide to talk about it. So let me see whether I got it. Okay. Okay, we start. We first see this picture. Here we see all because in the center we got the electronic health record here. Then all the data we gathering input into this centralized database, and this shared circle here. The important here is here they implement a layer called data monitor layer. So the idea is everything when they created or collected from medical device or from any HIS system, they will be monitored. So when for example, there is a new laboratory data, or there is a new prescription, or anything like a medical, for example, the IV pump, they generate any kind of new data. This interface, they will monitor all this data. So that's it. That's very important. I think this also very pioneer that I guess even in Shanghai Hospital that we don't have this kind of idea, is because all this data, we don't have a centralized interface to monitor everything. So that would be a very pity that everything is separated. So you cannot create a very sophisticated system that, but in the health design, you can see they're ambitious. Their ambitious is that they want every data could be monitored by a data interface. So yeah, think about if you want to create a system. So maybe you need this kind of architecture that you can have all the control of all the data. But later, we will use another diagram to describe the thing. So they create this called medical logical module. For example, they can identify patient if they have elevated potassium level based on laboratory result. Then also they can create a more complex logic. For example, if there is something happen, then they can retrieve data from other data. For example, but I think later we use another real example to illustrate. And the component of this MLMS, the first part is they will specify the data element, because we all know that the data is the central of the patient data. If you want to make any decision, for example, like the blood sugar or electrolyte level, first thing you need to describe is you want to measure what kind of data type and element. The second thing is you need to provide the logic. Then, for example, you need to provide, for example, you want to capture the anemia patient. So first, you need to point out this module is related to hemoglobin measurement. Then the second part is you need to provide the logic. You have to define what kind of threshold is was so-called anemia. If you want more complex logic that is like the female and the male, you can have a different threshold. So the second part is they use you need to store a logic to interpret the data. So that's similar to our the HL7 AAA design. We always say when there's a medical data representation, we use the AAA way to represent it, name value pair. Okay, so you got a name for identify the laboratory name, then also the associated value. Then the third thing is the interpretation. So all the medical data can be represented through this way. So we already see this architecture. All the data can be monitored by this data interface. So from the medical device, financial system, and also the decision support. But this diagram is not very clear. But later we will have another figure, but still not very straightforward. But I will explain because I also read the context, the textbook a little bit, then I understand how they work. But in the future, if you want to design a system, there are something you can this. Okay, I think this the pink one is something I added. So in the help system, here's how they design their system is the first is the patient data was generated, then they will use the data driver to collect the data. Then this data driver will pass this patient data into two different routes. The one is to store in the electronic health record engine. Usually we call it the data warehouse. Then this data driver, this patient data, they will send a copy to the decision support engine. Then the final goal is to generate the alert. So for example, that we have a drug-drug interaction. We want to monitor the drug-drug interaction. So the patient data that the physician they will create they will prescribe in his system. Then after they finish the node, then the data driver will store this data into the data warehouse engine. Then at the same time, they will send a copy to decision support engine. But in our hospital or in the real practice, it's not true that, because first they will send to here to check whether there is a drug interaction. Then if okay, then they will send back to, they will continue to store in the EHR. But anyway, we can check this. So the patient data, they will send to the decision support engine to check. Then here is, they will create, actually they has the coded table. Actually here they have bunch of rule-based table. So for example, if this is the electrolyte measurement, so then they will check the electrolyte, the base, the rule base, to check whether it is the critical value or not. But we didn't cover the detail about the code table. Maybe in the later section, there's I think there's the thing called Arden syntax. Arden syntax is the way how you describe, for example, like how you define in the previous example, like if the anemia, the hemoglobin is below 10 milligram per deciliter, then it was called anemia. So the Arden syntax is the way to represent that concept. So anyway, so there is a systematic way to represent those logic in the code table here. So when the patient data was created, so then will pass to the decision support engine. Here they will now apply the appropriate logic. Then after they created, then this decision support engine, it will decide whether they will need another additional information. So the decision support engine here, they will call back to the electronic health record to retrieve the necessary data, then make the final decision here. So, sorry, I forgot here is, they check the code table here, then they will execute the appropriate logic module here. So basically, you can see that the data, when it created, then you will need a coded table to check which kind of MLM should be executed for examination. Then it also need to for here, they also need a way to call back the electronic health record. For example, in the following, there is an example that when we is checking the creatinine level of patient, so normally if patient having a twice creatinine level than the normal people, it will create an alarm. But you can create a more sophisticated or more complex alarm system, is that if the patient which don't have the condition such as the kidney transplant or the kidney renal failure patient, because for the kidney transplantation patient or the the uremia patient, they already have a abnormal creatinine level. So at that time, they don't want to create that kind of alarm because it's not necessary.
So what are the difference between the code table and the MLM?
I think the code table is kind of lookup index. they will the code table will call the MLM. So this work together. So I think it's just the index table. You know how, for example, if you know this is a creatinine, then this code table, they check, oh, okay, this is electrolyte. Then they will know it's creatinine. Then they will go to look up the medical logical module to execute the logic and to decide it's a normal or abnormal. But in my example I just described, that the abnormal creatinine, if you want to create a more sophisticated system, that because if you want to exclude those patients already have the poor renal function diagnosis, then you don't want to generate the alert file. Then so in here you will need to go back to this, because that's a very clever way to design a system. You can imagine that, because here is they only just need to send one dimension of data, because if those, for the creatinine data, that if they only send out the creatinine data, then it don't have this way, then you will need a very sophisticated method that you need to also pass the creatinine level. Also, you need to pass their diagnosis. For example, whether there is any poor renal function diagnosis, ICD, then the decision support engine can gathering all the data to make decision. So they provide a bidirectional way to retrieve data. So you only need to monitor the single data stream. Then if the MLM it need more additional information, then they will go back to check the electronic health record. Then it makes the system design more much easier. Okay, so that's actually this picture, this diagram is kind of ugly and hard to understand. But after I read the content, then I finally get some idea about how they work. But I think the most clever way is they provide this the bidirectional way. Then they can provide create a very sophisticated method. So okay, then in the help data, from their beginning, their design, they never delete any data because they store all there. But I think right now is not a problem, because but at that time the storage is very expensive, but they have the very ambitious. They want to store all the data. So that's the basic design of the system. Okay. So the LDS, they got several kind of different system. One is the information management. I think previously we talking about a lot of this system. They got the pharmacy. The pharmacy, they can do the drug interaction, the drug reminder, lots of things. So we don't go to the detail. And the blood gas report system, the emergency department infection report, and nurse bedside charting, respiratory therapy charting. So basically, is kind of just I think I will call it the first degree. You collect data, display information, and pass in the information. That's kind of the first level. So if you are doing something related to information management, you can check about this section. Then the second category is they call it focusing attention. I think another way is kind of you can call it is a reminder or is the alert. Basically, is just they try to being a guard for helping the doctor that they use this developing those system, try to create the alert system to helping the doctor to for the clinical work. So here is the infectious disease monitor. So if they got a infection disease, they will generate some report through by daily. And also they got a therapeutic antibiotic monitor. So they will provide the guideline for how to use the antibiotic dosage and the ADE, the lab alert, antibiotic duration. I think those are common thing in the current HIT system. And preoperative antibiotic monitor and high risk and drug dose monitor or enhance the notification of ventilator related event. Later we will discuss this one a little bit. And LDS, they are famous for create a diverse drug event monitor. I remember they they have a NEJM paper talking about the AD here. So I have some more detail about this. So the original idea is they want to capture the adverse drug event because based on the literature, they say that they got a 2 to 10% of the hospitalized patient having the ADE. So, but we all usually we underestimate the actual ADE event. So because actually in our practice, maybe sometimes we notice there's a adverse drug event. Sorry, do everyone know what is the adverse drug event? Do you know?
Is it like drug-drug interaction?
No, no. It means, for example, I give you this antibiotic to treat you, but sometimes they will have the drug allergy. For example, we use a drug to control the seizure. Then it will call Tagrido. It had a very severe adverse drug event. It will some people has the genetic. They will create a very severe skin rash and the mucosa necrosis. Sometimes it's a deadly complication. So that kind of thing we call it adverse drug event. So, but it's hard. I mean, even for physician, sometimes it's hard to define what is so-called adverse drug event, and not mention that you want to document it and report. Oh, okay. There are some adverse drug event happen. So basically, this thing is because the idea is if we can, the third level is if we can monitor it, then second thing is we got a chance to analyze the risk factor for creating the adverse drug event. Then we can prevent it. Also, the idea is so think about this. You don't need to create a very sophisticated problem. Even this, like the ADE, the final goal is to improve the patient safety. And their first step is, can we capture those ADE efficiently? So their idea is, since we know ADE were happening frequently in the hospital. Like here, they got a 10%. So, so the LDS hospital, they think if we can use computerized surveillance system to identify it, then that will be very helpful to improve the patient health care. So here, there's something I think is interesting. This slide is very important. Is if you want to do the some research like national the health insurance database NHIRDB, here is something we need to know. So for here is because they don't know how to detect the ADE. You cannot rely on the physician put a mark on this patient, say, oh, this got ADE. So so they use their domain knowledge. So first thing is they want to see whether there is any laboratory test result is related to possible ADE. So but from our physician's view, we know like the eosinophil, he is some that is a measurement for the blood. If patient having the eosinophil increasing, we know it's kind of allergy or something. Then the second thing is elevated some serum drug level. And for example, like if we know that we ordering like the high dose of the steroid, we probably know. Sorry, I think the third thing is the ordering the drug. I think steroid is because if patient having a severe ADE, we usually will prescribe the steroid. So using some drug, we will know they got they just passed through the ADE, severe allergy. Then some serum drug. I don't have example here. Huh? Then yeah, possible. Yeah. Or any physiology data. Okay, if you want to check. But I think maybe Guoxuan, if you want to do some retrospective data, you want to look up some patient, you want to collect some type of patient, you might need to read this paper. Because the idea is they want to identify the ADE, the patient having the ADE. So they use those things, try to capture those data. I thought that this one we will so-called the heart of big data analysis, because only having this kind of knowledge, then you can interpret those big data. Okay, because the big data there, but how you from the big data, then you to sort out, to retrieve the ADE patient, then you will need this domain knowledge to capture it. So yeah, that's why I list this paper is because if you want to, I think that is also good for our doing the research with that. Here I can give you the example is in the TMU hospital, they publish a good paper about they compare the two different anesthesiology methods. Because for operation, there are two kind of way to do the anesthesia. One we call general anesthesia. That means you complete sleep, then the surgeon can do the operation. The second way is just the half. So the patient is awake. So they compare the general anesthesia and the half. The epidural, we call it epidural anesthesia. So some people, there are some literature talking about, they say using the epidural anesthesia have the better advantage on preventing the postoperative infection rate. So they compare the patient who received the total knee replacement. So for for the bone doctor, for the orthopedic doctor, for the old people replacing the knee, 那个膝盖关节啊 for the knee replacement, it's kind of common surgery. So they check out the NHIRDB. So because they know which patient receive the total knee replacement TKR operation, then they also know they receive the general anesthesia or epidural. Then the tricky thing is how they define the post-operation infection rate is because they say that usually for our operation, we only use 1 or 2 days antibiotic after operation. So there's another set of patients who receive maybe, I remember they calculate for 1 month. So one group is the patient only receive 1 or 2 days of antibiotic. Another group is receive longer than 7 days. So they define the patient having more than 1 week's antibiotic treatment. They call it was the post-operative infection. Yeah. So I cannot remember the truly detail, but it sounds like persuasive because for normal people you don't use such long time for the antibiotic, so you can easily from the pattern to define. Yeah. So they got a number that the epidural anesthesia the general anesthesia, they got twice 0.1 times, 2.1 times post-operative infection rate than the epidural. So yeah, but you still can challenge a lot of things, but the result is convincing because it was published on Journal of Anesthesiology. Because but you still can imagine that sometimes we will say only the weaker people you will choose the general anesthesia but I think they already do some demographic comparison because you need to justify all these compounding factors. But that is a good paper too. I think that give you. I think next time I will send it out to you that but through that kind of idea you can. It's quite straightforward. So it's not a very complicated design, but it provides some possible result to reflect the truth. Okay, yeah. So if you want to do some retrospective analysis, that this is kind of way how to do the research. Yeah, previously I talked about that. You can just some simple systems. You just create a critical value if the serum creatinine is abnormal. But if you can also according the patient's diagnosis, for example, the renal failure or kidney transplant, because for these two type of patients, they have the elevated creatinine level. That's some common thing. So you can see back to this data set that I think in Taiwan I don't believe any of the HIT system they have this functionality. Yeah, because I think if they got the logic that they know which one is abnormal, that is good enough. But you can see this guy from in Salt Lake City, they are crazy because they just want to create a wonderful world. So even they have this thought 30 years ago. Yeah. So yeah, always reading those old things, they still give us some idea. Okay, so yeah, previously when you write in the paper, you always need to remember what's your benchmark. You want to create a system, then ADE, the original is 9 to 10, then you believe the true number is 500. So if you want to create an ADE monitor, so one way is, oh, okay, I want to detect more ADE. So if you can prove you can detect more ADE, then you can say you have better system. But again, we previously talked about this was so-called classification. So you will use the ROC curve because there is a true positive, true negative, false positive, false negative, that kind of thing. How to evaluate your system. Okay, so yeah, this is the reference from the SCAR event. So if you want to read the detail, you can go to read this paper, the risk factor for adverse drug event. Yeah. And this another paper is they create a system to enhance the notification of critical ventilator event. I think this related to the Meiron's research because basically they are similar. They working on data from ICU. So this paper they talked about some description. So later we will discuss some detail about this paper. So yeah, the last session is the focusing intention. So then also they got a session called the tools for patient-specific consultation. So basically, it provides more sophisticated. Not only the first level is patient information management. The second level is create the focusing attention. The third thing is they provide a different tool or calculator help you to treating the patient. So they got a blood ordering ventilator, suggest you the ventilator protocol, or they suggest you use what kind of antibiotic or the patient isolation program. So those are three levels they created in the LDS hospital. So yeah, then here this is their conclusion. The first thing is the timing of data is critical. So you can see that if you really implement a system, you will know that how you put the gateway to monitor all the data, that's something very important. Like Zhiyang and me, we create the automatic report system for disease surveillance for all the hospital. But until right now, we still, because all the laboratory system, they collect the data, then they have the abnormal value. Then we develop a lot of logic. So, but those systems was newly created. So the first thing is you need to guarantee all the data will be monitored by this interface. Then you can capture all the abnormal data. So the timing of the data entry, or we can also call it data flow, is kind of the important. So the timing, you need to care about the data entry. So like yeah, in the paper they will discuss. I think all of the people here, if you want to design a clinical decision support system, data always is a problem, because ideally is you want all the data to make decision, but the problem is usually you only cannot capture the perfect data. said. Then the second thing is the clinical domain expert is always the key man. So yeah, if you're working on something, you always require the clinical domain expert. Yeah, I just show you the ADE. If you are not a physician, actually it's hard to think of to having that kind of logic. So yeah, we need, if you are working on like Meirong, Miss Wu, her project, but he is a nurse background, so that would be okay. But like Zhiyang, he is purely from science background, so he didn't have enough clinical domain. So he need to work with the clinical domain knowledge. Okay. So the decision support, they need to create it with the work process. I think we already show that. Then the fourth thing, that thing is tricky. The FDA, they talk about, because their argument is we have FDA for all the drug for treating the patient. We have all the FDA regulation for the medical equipment, but for those clinical decision support systems, we don't have the FDA regulation. So yeah, think about that. That is very tricky. Yeah. They talk about this. They have the discussion, and I remember several years ago is kind of important issue, but I guess it's just too complicated because not like a medical device, even a medical device or drug, it's already complicated enough for certificate for the safety. Even they have a very thorough system, but still have some faults. So I guess the idea is, yeah, we need a certificate for those clinical decision support system. But for example, like the EKG, right now, yeah, for me, I'm not a cardiologist specialist. Now, then we rely on the machine because then we put the lead on the patient, then it will show the result of the patient. Then sometimes we just trust it, but actually that's very very dangerous. Or the possible thing is, in the future, because the information just too complicated, think about the genetic test. All these genetic tests, their interpretation are rely on machine, because I don't think the human being can read the gene and do the interpretation. So how you design a system to use the computer to help you make decision, that is something important. So here is, I think that they know the safety. So yeah, they always very being careful to deliver messages that, like the previous slide, we say those decision support system, we don't teach clinician. We always make suggestion, because if they teach physician, that is sometimes is very dangerous. That because we cannot guarantee that computer make a correct suggestion. So think about when you create a system, you always need to think about the safety issue. Okay. Then safety. Then don't think about create a big one. Always start from the smaller one, because the clinical data, the clinical setting is kind of complicated, because you need to gather in all the data. Then the MLM rule be evidence-based and match the logical process of patient care. I think this one is something old, but something right now is interesting is One thing is I imagine is we call the precision medicine recently. I think there are several fields related to this. Because in the past the evolution of the medical treatment is based on lots of physician experience. Then for usually the experienced doctor in this field, after they practice for more than 20 years, then they got a sense for treating kind of disease. Then they got the experience. Then if they got a chance, they will create a case control study. If they find a significant result, then okay, then our medicine, they just moving forward one step. But right now, like the Obama, I remember this, I think is in 2014. They got a mission. They said that the evolution of the medicine is just too slow. Then we want to create a precision medicine that, precision medicine that is, since we got a lot of data, so I think that's a further version of the personalized medicine that since we know how we treat everyone, then we got the outcome, we know we treated good or not. Then actually they hope some IT technology can help to change the clinical practice guideline faster. For example, like the statin. Statin is a drug for lower the cholesterol. Then in 2012, the Danish report said that people taking the statin can reduce the cancer mortality rate. And also like the aspirin. The aspirin, they got a hypothesis that the aspirin can reduce the chronic inflammation, then they can improve reduce the vascular disease. So those things, it is easy to get. You can find the evidence from the clinical data. So that's something that I think in our GIMI, they got a paper talking about the brain tumor associated with the BCD. Yeah. So that is some kind we call evidence-based medicine, or something that we want to generate those things to help to improve the patient care. Then this one, yes, the logic and the rule need to be periodically reviewed and improve update. This is so true, but even the first step, we don't have it yet. So but it is true. Like that's one of my conclusion about the vocabulary mapping, because we have I have the same argument. I say we have to periodically review the terminology mapping, because it can be wrong and also be updated. So you can think, those things are created. They know this 30 years ago, but we still So again, so you can see that. So the good thing is, or the best feature is, everything is being reviewed and updated. So this implies that if something you periodically review it, then you find there are some problem. Okay, then that is something you can publish it. Okay, so the argument is, it's just like the clinical guideline. For example, like the warfarin drug use. I think currently the guideline is for everyone just using the same guideline. But right now we know we have the genetic test. So if you got the genetic data, so you can give the patient by their genetic data by different dose. Or if there is some I think in the ER, sometimes you just every year they change the the guideline a little bit.
We didn't do the review and update. So
Yeah, of course. But the good thing is, if you observe the patient in your department, then one thing is, if you can categorize the patient into two categories, one is good outcome and the bad outcome, by some factor, then you can write a paper. So yeah, that's something I want you to establish in your mind is because you need to have the sense, because you need, yeah, sometimes we call it classification or clustering. You always need to observe in your particular or some single category of patient, then to see whether there is some factor can categorize them, then which one having the better outcome and the one is have poor outcome. If you can find one factor can categorize patient into good outcome and the bad outcome, then you can write the paper. But always we do things bottom up. So first we have the patient data, then we observe, then yeah. So yeah, I think maybe later we will use the real case to do that. Okay. Yeah, think, yeah, minimalist. Just think, just don't. You do not create something that the physician need to learn again. Then you will create another set of problem. That's my conclusion for my lawing. Yeah, because it's just too complicated that even me, I need to think it again. So people can easily make mistake. Okay, so when you do things, always the advisor talk to the student and say, okay, be simple. Yeah. So for the first year student, they always say, oh, I want to save the world. Then, but I think if you the third, 4 years, like right now, you want to submit a paper to international or something, but before the deadline, then you will think, oh, okay, any kind of thing will be fine. So. Evaluation is always the hardest part. Yeah. So later, I think I will use one class to talking about the evaluation method. Yeah, because I guess yeah, for all of you, if you are creating something, because you are creating an expert system, then you will need to decide it whether it is good or not. So yeah, always you were having you need a evaluation method to say here. Then I think I will introduce we call it reviewer agreement, associate expert agreement. Yeah, there is a CAPA. There's a way. Yeah, the idea is there's one thing. Then you will ask 3 experts, and the 3 experts will vote. They will say agree or not. Then they do it the review independently. Then they will calculate whether for example, if something 3 reviewers they both agree, then they thought the quality is good. But if there's one thing, two are agree and one is disagree, then something or if something is 1, 2, 3, and if every expert choose one, okay, they both agree. But if one choose 1, another choose 2, another choose 3, then there's a disagree. So there is a way you to evaluate the expert system. But I think later we will find a case to do that. But mostly that's related to when you do something related to the expert review. and cost effective is always a problem. Okay, and the physician's support order entry is easier to get it all order. Okay. Okay, so yeah. And yeah, the Scott Evans, he has a lot of paper talking about the system launch in the LDS. I think that's all quite good. So if you are writing some paper, you don't have the material, try to check out those papers. That will give you the idea.
我是请问一下，这个安眠药的使用没有造成骨折，这个算是
对我刚
AD
刚正想在问说，其实我这2天有上去找一些那个，就是 endotracheal tube 那个 unplanned 的那个 extubation， 我只找到一篇，我不晓得是我 keyword 下错。
我想应该是有啦，来，我再帮你找找看。
听过其实就很多。
对啊，我就想说为什么？
你那个身体是我之前听过重症的医师讲过很多次。
对，因为不是要做行动营的吗？这个就其中的一支指标。
对，这个
可以啦，就是认真做，你就是要花心思。Yeah, we are talking about Miss Wu. He need to create he need to do something related to her project, but he cannot find the actual keyword from. He tried to but she cannot find it. But maybe later I will introduce how I search literature. That is something that But this paper I think is published from Jamia 2005. I think this paper is quite easy and straightforward. Basically, just the idea is all the ventilator in ICU, they are connected to computer. So the first thing, if the ventilator disconnected, then the system will design. It will define it is a critical event or not. Then if they think, oh, that patient is in dangerous, then they will shut down all the monitor in the ICU. Then there's an alarm say, oh, in the which bed the ICU, the ventilator was disconnected. Then okay, that's straightforward. They say, oh, I want to create a system. If it capture this disconnected or ventilator, then that is dangerous, critical for a patient. Then I will shut down all the monitor and just show you. Just want to remind you. Okay, then they publish the paper on here. Yeah, so that's something I want to show you, that you can see that the JAMIA, that's the leading journal in our field. So this because in our field is usually is create an application. Okay, so here this is the category is application of information technology. I put this paper in our Dropbox, so you can check it. So the idea is quite easy. Just they show you alarm in everywhere. Then okay, so you can see the background. There are a couple paper talking about. There are some like the history of developing the ventilator and how they're setting, and they make the visual, audio, auditory alarm. It's kind of trivial, but you need this kind of trivial thing in your paper. Okay. For I don't know in Indonesia, but for Taiwan people, we always say that we are not good at writing the background, because we don't, from our education, that we don't teach you how to speak a story. We are trained to problem solving. The teacher give you a problem, then you try to solve it. So we were trained that the way. But if they give you a set problem, just give you a title, say, oh, please say a story about the ventilator. Then, oh, we don't have nothing. We have nothing to say. Yeah, but that's why I keep try to remind you again and again. Is that's in the future if you start to write thing is yeah. So you cannot write this kind of thing on your own. But read the paper, okay? Then and try to mimic their logic thinking in your brain. So so you, for example, right now I got several years training. Then I start to have some idea about the background. Usually we will say from general to specific. The first thing I will provide a very general idea. Then since this, I think the general idea is I will give you some introduction about the ventilator, their development, and how they're setting in the ICU. And the second thing is I will focusing because in this paper I was talking about the patient safety, about the disconnect, about the ventilator. So then you will need to provide the evidence. For example, the accidental rate about the disconnect ventilator in the ICU, and also provide how many they created the lethal complication. Yeah, then you have to for example, if disconnect of ventilator is not a big deal, then just put it back, then never harmful to patient. Then that is not a important research question. But I think I guess disconnect of ventilator is kind of urgent and also some frequent event in the ICU. But again, you need to provide the solid evidence. So it's the same. You need to when your boss you want to do something, you have to say, oh, this happens so frequently, and that's in the accidentally extubation is kind of a big problem for the patient. So then you need to provide the evidence. Then look at this. Then the paper. Yeah, they design their system. Okay, they say they have their LDS EMR, their help system to gather in the data. Yeah, it's kind of trivial. Then they have how many ventilator those thing, and how they connected to the computer. And that's something you can mimic. Yeah, they collect all the data, then they categorize all these. Yeah, because for example, disconnection of ventilator circuit, then during the medical procedure, or the obstruction of tube. Yeah, there are something when you do the disconnect, but all these things, some are intention to do this. So sometimes that's for treatment, so you disconnect it. But sometimes it just like the kinking or those things are abnormal. So this is kind of a description of the ventilator disconnection. So you can see when you're writing the paper, you collecting the data. Then the first thing is I want you to describe your data first. Okay, so here is the example. Okay, so when you do the extubation, actually you can also have in this table. Okay, then this diagram, it's easy. Just the help system, they will because everything is connected to internet. So if they got the alarm alert, they will shut down all the computer and say in the you can see the ventilator disconnect in the room. Then actually this author Scott Evans, he give us he talked about this system in a class. then this is something very funny because the ventilator disconnect actually is quite often happen in the ICU setting. So they just shut down the monitor. Then I remember that's just a very disturbance for the daily routine work. So that's the first version. They just shut down all the monitor, but people complain about it. So I remember they got some updated version. Is they have some flashlight or something to instead of shut down all the monitor, because only if you prove your system are very efficiently, then never make a false alarm. Then yeah. So but at the beginning they just shut down all the monitor and make sound and shut down all the screen. Yeah, I remember they make a updated version is they use the flashlight or something. Yeah, don't disturb the original the daily work. Yeah, so here you can see disconnect during procedure other watering in tube. So you can collect data. So make this, you will need to describe all these things. And also, because I think, yeah, the duration is also important. Okay. Yeah, so I want you, if you, all of you, yeah, got the time, I encourage you to read this paper. Yeah, you can see the ventilator alarm, they categorize in different ICU setting, okay, and also classify the reason. Then they conduct a pilot study. Then there were number of events. Yeah, so yeah, try to see whether this paper can give you some idea.
所以像老师你刚刚那一篇文章啊，它比较偏重在照护层面的一些改善，对不对？因为它就是它机器在 alarm 的时候，其实我们有时候就是就好像没听到。那它
I think just the focusing attention. Just because that, yeah, it want to draw your attention because the original is the ventilator make the sound or some signal, but maybe you are somewhere, so they create a system. They can collect those signal and path to the internet to all computer. But this was back to 2005, so that is kind of a little bit pioneer that you can send an alarm message to a whole setting. So, but that is not teach physicians something new, but just kind of alert, give you
awareness.
Yeah. Okay. So yeah, since I think the second set of slide about I want to talk about the modeling issue about the EHR, because previously I already tell to you that if you want to collect the data for research, how you collect or design a good database, that is very important. I think Ms. Wu, you already encountered that problem is because you want some data, but it's not recorded in the database. And also, since we don't start to using the weight cut or some statistical program, we didn't teach you to do the data transformation. But I want to use this set of slides, give you some common complex issue about represent the EHR. I think at the very beginning of class, I already show you that, for example, how you represent the category data into a binary data. So there are some common way we do the data representation. Okay. So here is the diagram. We represent the blood pressure. Okay. If you want to collect a patient's blood pressure, you will need to have the systolic and diastolic blood pressure. And usually you will have something like this. So the good thing is, because we know this is the blood pressure panel. So think about if you have a very sophisticated HIT system, like Guoxuan, your project, you want to ask the IT office, the IT expert to help you to retrieve all the high blood pressure patient. Actually, the database administrator is kind for them to retrieve that, because first you have to know the data structure of the database. Otherwise, you don't know how to retrieve the data. So if that's very important, that you need to have a very good model, then you can retrieve those data efficiently. Okay. Then I think right now we already know that we need some standardized term to storing the data. Okay. So, but here is I want to show you that we want to represent the knowledge that by human being we can read the numbness of right arm, left leg. Okay, so we can see this idea, and here is the numbness left arm, right leg. For human being we can understand it, but since they got the same set of coded data, but yeah, they want to represent the numbness of right arm and the left leg. But if you just put those ideas randomly, then actually computer will get confused. You can imagine. So not only the coded data is good enough, then we need the structure to store it. So that's, yeah, think about the EHR. Or for example, like the Shanghai hospital, we want to send a patient to Beiyang, then then we want to describe the thing. Then we just send, okay, we say, oh, we want a standardized terminology, but we just put the thing. Then, yeah, but for example, I want to check everything with the left arm, the problem, then actually they store in different columns. So that would be a problem. So that's idea is we need a data structure. So that's another thing is, yeah, the dry weight or weight dry, okay? Because we have, for example, you wear clothes or not wear clothes. So you can have a way to have a dry weight, the kilogram, and you also can have the weight and put number here, but also have a dry weight, okay? So ideal. So this one I want to show you the modeling is important, okay? So before you start to collect the data, or think about the modeling, and usually we say that it needs experience, okay? So yeah, maybe if you don't, I think Dina, Guoxuan, Miss Wu, Jiang, you all already having doing some data, you playing the data already a little bit, so you will know what I'm talking about, because the same thing, but you can use the different way to represent it. Okay. Yeah. So you can have a different way to, you can dry weight, current weight. Yeah. This kind of tool style, we assign a term for it. This kind of style, we call it pre-coordinate, because we already do the combination of dry weight together. And dry is one atomic concept. Atomic is minimal, the most mini, the smallest concept. Because we say the dry weight, it's kind of more general or more coarse concept. But we say dry is more, we call it atomic 单位了，最小的就是一个单位。We call it atomic concept. So the dry weight, and you can see, so this, they put two thing idea together, then we call it pre-coordinate. So they already do the combination first. Then this way we say it's a post-coordinate. And what's the difference? Because all the computer can understand this. The problem for the first style, this is they will face a lot of combination problem, because you need, if here they got the n choice and here got the m choice, then the total combination is n by m. Then if you have the n by m, the number is very big, that would be a big problem. And here, this is a good thing is, if you only n and an m, so you only need to create n plus m combination. But the problem is, this one, the meaning is very clear and very precise. But this meaning, if you use the different wrong way to interpret it, then it will create, well, we say this meaning is more ambiguous. Because if you don't know how to interpret the column correctly, then you will make mistake. Okay, so yeah, that's something so think about but both things are good. There is no sometimes, yeah, later then we have another slide to discuss. Basically, the conclusion is the modern database should both provide this kind of tool style. Yeah, I mean, for the different purpose, but maybe it's the system automatically created. Yeah, but that's some actually those things are truly the heart of the EHR. Okay, so yeah, in Taiwan, lots of people are talking about EHR modeling, but actually these things are the heart of the EHR. Okay, because we are talking about the modeling. Because yeah, even just for example, like I want to develop a diabetes international project. I want to collect all the data from all the international. Then I want to collect all the body weight from different countries. So each country, they can create their own way to describe how you store the weight. So we need we need to have a standardized and the most efficient and the most accurate way to represent the knowledge. Yeah. So if you think about the international scale, then how you choose which style, that is a big problem. So, but you can examine the current HIT system. Actually, they just who designed this always is the IT guy. always the IT guy, they design the database, then they say, oh, the physician, you need to store the data by this way. Okay. It seems like you got confused.
But the below one is higher standardization. 是算有比较高这个吗？
这有点，我看这算不算正规？
我好像有
这不是正规化，
因为它是等于是把两个 key 把一个 key 把它分成。
正规化是在讲说，它的 data 假如有一长串的 data， 假设它有在不同的地方出现的时候，它把它 break down 成最小的东西，然后不能重复。可这个不是。We are talking about. Goshen is asking, this is like the database normalization. Yeah, the decomposition part is a similar concept, but we are not big. Yeah, so you still can, yeah, because sometimes we call it, if you have both types, some of the information stored in the system, we call it redundant. Mm-hmm. In the past, we say we have to avoid this kind of redundant to save the data storage. But currently, the data storage is not a problem anymore. So both having a good strategy, because the first one is more straightforward and more, but the second one is, if you want to retrieve data, the second style is more straightforward, because if you want to, because the observation type, because think about, you have a weight, height, a lot of things. So if you want to retrieve the patient's data, their body weight, then you just need to make condition on this. But if you do this, you need to scan all the data. So that's kind of balance between the data retrieval. So, but right now we say the current the modern database, they should provide all the his system should provide both kind of capability. Okay, but I just want to show you, when you're making a decision, when you're designing a database, this kind, you need to think about. You have to think about it. Okay. Yeah, Loink. I think yeah, Loink. In the future, if you we got the chance, I can show you. It is true. Even we use the standardized terminology such as Loink and SNOMED. You have but mostly it's pre-coordinate and post-coordinate. So that's a big problem. So, but I can tell you the conclusion, because the SNOMED, they try to create the post-coordinate way to represent the knowledge. But because then, but like the previous, I give you an example that the 3 commercial company, they try to use SNOMED to create a rare disease questionnaire, but they use it differently. One use the pre-coordinate and one use post-coordinate. So that have the problem. So SNOMED, they decided, because Loink name, they provide, Loink name is more like a pre-coordinate way. And the good thing for Loink is they try to make balance. The good thing is they provide the 6 axes. You can imagine that each axis is one atomic concept. And they only create the combination when the real world need it. So because each axis you can create a Loink name, but Loink didn't create it. They only create it when they need it. The idea is okay, the SNOMED, the problem is, the argument is because we always we use the SNOMED, they create the concept pre-coordinate. But there are some, for example, the SNOMED, they have the concept for left. One is for arm. But right now, SNOMED, for example, there is a concept, left arm is a common one. So then they just create a pre-coordinate concept called left arm. So that's for some practical issue is because if you allow people always, I think the idea is for human being, the pre-coordinate concept is better. It's better. The problem just too much combination. So the SNOMED choose the different way is if something that's really used frequently, then they just create it. Okay, that is something also I think is like the zip law I talk about. Yeah, I think the SNOMED, they got a 40,000 or more than concept, but actually the frequent use concept is not too much. So the SNOMED, after they learn the experience from LOINC, the SNOMED, they try to create some pre-coordinate concept data set to solve the problem. Okay, then yeah, we already said that the name value pair. Okay, that's the medical knowledge. We always use the name value pair to do the representation. Yeah, so yeah, think about the LOINC. It's only document the laboratory data. That's complicated enough. So if you are interested about, currently some hot topics using the LOINC or other standardized terminology to represent all the thing. But yeah, this is out of scope of this discussion. Yeah, there's something. Yeah, these are some. We got the Netherlands, UK, the UK is the famous one, NHS. Then Australia is Open EHR. Then HL7 they got the CTA, and Intermountain they create a detailed clinical model. And the NIH, this called the CA-BIG. This they create a common data element. But both, I think right now the Open EHR and the data clinical model and the UK NHS, they are merged. They try to create a single universal EHR for international use because they think it's too complicated to create on their own. So yeah, all these 4 countries, they join together to create. Yeah, okay. Here is, I want to, previously we talk about when this talking about the data model representation. The first requirement is we want it accurate because our hypothesis, if we use electronic to store the data, so the data should be faithful to original meaning. So the accurate is the first important thing, and unambiguous. So it only have the one meaning. So that's a big problem because computer they only understand one thing. So if you have the different way to represent the information, then the computer will get confused. The third thing is understandable. That's why because you can not only create the thing is computer readable, because like the Loink is a good example. They create not only the number code, they also have a full name. Okay, so they create both things. They got a code and the number. Reproducible. So previously I introduced the two-way to represent it. So they think the two different models should be transformed to each other. And parsimoniously and harmonious use of terminology. That's the previous I described it. We try to create only the thing like the Loink. We only create the real thing if they do exist. You got the idea? Actually, this a little bit complicated. 就是我们有很多的代码可以去表示同样事情。那你可以把所有的码都把它组合起来，产生一个 concept。不过我们不会全部把它真的都组合。比如说，你不会把左手上臂腐化，可是这个不是很常见的 concept， 你不会把它摆在一起。左手上臂骨折是常见的，我们才会把它产生。就是说那个，因为临床上你要把它全部都弄组合，你要把它表示出来，它才会有意义。然后你要把它先组合，它才会有意义。你要把它全部拆散的时候，就会很大问题。所以我们只有把组合真的有出现的时候，才会把它组成。Okay. This kind of balance between the pre-coordinate and the post-coordinate, and we hope it can flexible. Okay, and the different domain we like the specimen collection, the charting, we need to consistent to use it, and we have to can practically use and minimally the complex, because if things just get too complicated, people cannot use it, and the common query are easy, because I already showed that like the Jiang, I think he got the experience that we want to retrieve the data from NHIRDB. But if the query is just too complicated, then it's not. The one thing is you will forget how to retrieve the data. The second thing is you easily make mistake. So actually we got some problem on the query. If you retrieve the wrong data, then you will generate the wrong data set. Okay. Loink is pre-coordinate because they have 6 acids. Then each acid because you can put everything in each acid, but we only create a name for a real laboratory. Okay, we don't, if something like A, B, C, D, E, in the real world, there's no that thing, so we don't create this code for it. So that's called parsimonious. So it means So then here I think the assertion and the evaluation style. This one is an important issue in our Loink. I think in your data set, you will face this problem again and again, assertion and the evaluation style. I think previously I already give you the example. If you want to document the hair color, actually you can have the this way. You can have the multiple choice. You can just choose one way, and you can also have the hair color. Then this one is very, I think it's very clarity, okay, clear. when you hair color, you just pick up the, if you pick up the brown, then you will know actually it's a brown. And the hair color here, you just put the text box here, then you will require the data inputter, they put their observation. Both are fine, but for the computer, we believe the first style is better. But for actual use, this one is more flexible. For example, here, there's no black. So this style is more, I think this happened again and again when doing the clinical charting. Like previously, I'm involved in developing the admissional system in our hospital. And we have this issue again and again, because for the efficiency, we prefer this kind of style. You just click, 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 and also the result is very concrete and very accurate. But sometimes we will have, when we have a whole hospital discussion, then they will have some department, they will arguing that, oh, you don't have enough choice for all the things. So we got a mixed style. We provide this, and in the end, others, yeah, you are right. So we have this kind of style, but yeah, so for clinical, this is a big issue. Okay. Okay, this is evaluate. This is called evaluation style. Okay. Then this is the assertion style. Evaluate is mean they provide something, that you evaluate it, and you put the answer. Okay. Then the finding is kind of a set question. They give you the finding, then you make assertion. Yeah. Both are fine. This one is more flexible. Then this one is more accurate. But the problem is, it's not always easy to design a system like this way. And this one is more flexible. But for computer, for this assertion style is much difficult to processing. Okay, the evaluation and the assertion style. So which one is better? Okay, both evaluation and style accurate and unambiguous, but for the evaluation style, it's better for data entry mode. So if you, in the future, if you want to design a system for you, if you want to, in the ICU, you want a helper to help you to input the data. The first one is, this style is better, because you can make sure the thing is accurate. But for this one, yeah, if someone is not well trained, they just put the wrong thing or some typo or anything. So yeah, so if during the input stage, the evaluation style is better. I think the assertion style, I think this one is previously we discussed how you transform the category data into a binary data. Okay. Previously we demonstrate how you transform the category into, yeah. I think this bullet is talking about this way. The assertion style, you can use the present and absent column, then you can do the statistical analysis. Okay, and the evaluation style is preferred for storage. Okay, when you want to store data, the evaluation style is better. And here is storage for assertion style is best for reason, complication, and final diagnosis. I think this one, do you know the reason? because the choice of reason, complication, and failure is just too much. This one is unambiguous and quick, but you can think the diagnosis for the patient, they get 1,000 of diagnoses. You cannot create this. So here is, so you can think the balance between this. If in the future your system, the thing you are going to input, the choice is very limited, then you just choose the evaluation style. So that's very accurate and very efficiently. But if that is for the reason or for complications or for final diagnosis, the problem is those three things, or in the future the thing that just too complicated, then you just provide the assertion style. Then the idea is at least you don't want if you just make three choice, then there's, if the, I remember this style is you got A, B, C, D, E is none of all. Yeah, just like 99 or something. If you check the database, like the TBI, the trauma, we already examined the traumatic head injury database. Actually, there is one choice is called none of all. Then that become a weakness, because a lot of data inputter, they just for convenience, or sometimes they just don't know which one is better. They just choose the none of all. Okay, so actually there's a paper talking about the terminology. They say actually we don't encourage people to create a choice, say none of all, because that is not helpful. Okay. So the conclusion, you need to support both styles, and then you need to be able to convert between them. Okay. Yeah, this previously we talked about the pre and post coordinate. Pre-coordinate easier for the entry, like LOINC, but the problem is they will lead to the combinational explosion. So the LOINC, they choose the balance is they try to create only the existing thing. Okay, they don't try everything. If they don't have it, they don't create it advanced. The post-coordinate, easy to coordinate thing. Okay, they can easily just put everything together. Okay, but I think I can just tell you the suggestion. Just choose the pre-coordinate. Don't make. I don't think that your current project just too complicated. Just choose the pre-coordinate way. So don't, because in Taiwan we don't have too much well resource that you can ask a very experienced nurse or the assistant help you to collect the data, but just the post coordinate, they will require some knowledge. They need to know the methodology and the philosophy to collect the data, but I don't think it will feasible in Taiwan. So just do the pre-coordinate. Okay. Yeah, there's something.
请问什么时候我们才要做 pre-coordinate 跟 post？ 是 post 我们需要受过一些训练，还是说资料在取得上面，如果临床上比较方便用 coordinate？
The pre-coordinate is The thing is, because pre-coordinate can deal with some simple thing. If things are simple, then just use the pre-coordinate. It's easy. If you only have the 10 choice, you just create 10 choice for the selection. But if you have the 100 selection, like the diagnosis, then it is impossible you create all the lists for the So for example, like in your ICU, like the category of ICU is limited number, like MICU, SICU, or MICU A, MICU B. So in that data set is pre-coordinate is better. So you just list all the choice, then people just select it. And for the post-coordinate, for example, the diagnosis of patient. Yeah, it's hard because maybe you got a 10,000 different diagnosis of the patient. So it's hard. You create a code for all of them. So at that time, you compare to you just provide not good enough list, then people just will record the wrong data, or just some miss. They just choose the none of all. Then at that time, we just will we use another way. We just use the for the post coordinate. You can allow people to represent the concept.
那这两个跟上面讲的那个 evaluation 或者是 assessment 的那个 style 有什么不一样？如果这样，它的 post coordinate 就是像你现在讲的这个
This one is more like a pre-coord. No, this is not. This one. Sorry, I should correct the saying that when you're talking about the different way for input data, we will compare the evaluation or assertion style. The pre and the post coordinate is not fully correlated to evaluation or assertion style. Okay, but mostly the evaluation style, we are talking about the pre-coordinate style. We use the pre-coordinate concept because you have to list everything together. So that is the pre-coordinate concept. It's okay. I know. Actually, I'm being the teaching assistant for this class for 3 years. But I listen it again and again. But when you listen and explanation, you get idea. But if I ask you to rephrase it, then you will get confused. But it's okay. But I just want you to have the feeling, okay? But you can see the difference, right? You got the idea that I think in the clinical or our daily process, we are struggling on this kind of two style.
所以我可以说，如果这个 evaluation 的 style， 这个在 input 的资料上，它是一个比较属于结构式的，
比较好，比较他刚刚是说比较快速啦。
对，就是因为我给你结构式，你就只能选这几个，你又不会乱选。对。那下面这个就是因为它有太多的不确定因素，所以我让它用，比如说你刚刚讲到的，像说它是它有一些 final diagnosis， 或者它有一些 complication， 可是这个我们当然没有办法用结构式的给它，所以就会比较用。
我是把它用 database 的概念来讲，就是说，因为你这个，因为 database 就是要越小或者越好找，对啊。你假如说这个就是 hair color 的话，你要用 database， 就是你用下面的方法的话， 就颜色角很能限定就直接用嘛。但你假如说是会有很多种描述的话，就是会变成你就要排很多。所以我目标当然就是最简单最 OK。就假如说男性女性，我当然是一定用2个。因为假如说是像病例的，他是肚子痛，甚至哪里会痛，那我可能就用像下面这种资讯 style。对啊，我方法只是选去让它能够达到最好的一个 data 的收集。对啊，然后刚刚那一种那个 reporting 那些的话，是去描述一件事情，所以说就是那个有点像是那种继承性的那种，就是说因为一个是没有拆解的结构，就是用就英文的形容词去形容，然后最后一个名词，就先加属性给它，然后最后变出来，然后另外一个是去查分类，像资料夹子查，我不知道我的理解是这样。
The first style is more intuitive. I don't need to think too much. I just check, yes or no, or this brown or brown, red. Just check yes or no. But for the assertion style, you need to think. I need to observe first. I need to come up with the concept. Then you need to So the first one is very much for when you do the data input. The evaluation style is straightforward. So the data inputter, they just need to say, yes or no. Yeah, the thinking process is much straightforward. But the assertion style is you need to think about, what it asks me to observe what. Then I need to come up with the data value. So yeah, another problem is the problem is the report value. Actually, this become a big problem in clinical, and we like for the long we also face this problem is we say the name value pair, but for the value we have different way or different style to store value. So actually in the EHR currently we already facing this problem is because we allow people to store data. I give you a very big problem in Taiwan, the current project we are doing. Because for example, we are in hospital for the Salmonella. It's kind of bacteria. Salmonella is a disease for causing the diarrhea. And our CDC require all the Salmonella related laboratory need to submit the report to SCDC. And actually we do observe these two kind of style, because one style is in the hospital, they got the laboratory test name called Salmonella. Then the report value is positive or negative. But we also have another set of laboratory result it called culture, and they put the Salmonella inside. So both are represent a similar thing. One is Salmonella, then we put the value say positive. It means there's for example there's a black specimen. Then we using some examination test. Then we confirm it contains the Salmonella bacteria. So at that time, though, in the data we say, Salmonella test positive. That's one style. Currently, in our research project, we call it type A. And we have different style. Because sometimes we don't know what kind of bacteria, so we just do the culture test. So then also at that time it's more like an evaluation, because we don't know. One test evaluation size is we thought we are interested whether this one is Salmonella or not. So the test just give me the result is Salmonella positive or negative. But the second style is we don't know what it is. but we know it's kind of bacteria, so we do the culture. Then result is more like assertion. It is well, oh, after I got the answer. Oh, okay. Oh, the culture result is salmonella. Then we put the salmonella there. We put the salmonella in our final result. So actually, we have both kind of style from our laboratory system in Taiwan. So yeah, so the system we need to deal with these two things. But both they have some rationale for doing that. But yes, that is the best example that in our clinical we face this kind of style every day. But we just need to face it. Yeah. But again, we encourage the evaluation style because for system design, for the computer execute the logic, the evaluation style is better. So unless there's no way to do the evaluation style, like the diagnosis and communication, those kind of things, then you just choose the assertion style. Then otherwise, it's better just do the evaluation style. Okay, I think the rest of the topic negation, yeah, this just to try for, yeah. I just want to give you some idea about the different type of inputting data. Yeah, so.
老师，对不起，我请问你一下，像你做这一个投影片，是它本来就有软体可以这样咚咚咚出来，还是说我们需要给一个设定？为什么你每次一按就咚咚咚咚出来？
哦，你说动画？嗯。你是说可以这样子一个一个？你是说这个？
对，它是有特殊的软体吗？还是？
没有，就 PowerPoint 里面有这个功能。
有动画。就是
自己设定动画那一部。
对。
进入的数据是这样。
Yes. Okay. Sure.
平常说这一门课很累，就是都没有下课时间。
哦，真的哦。
但是它背景存，它现在两种模式都要，但是对于 ordinary 应该是会更拆解的更细存法，它比较像 database， 然后 precoding 比较像是我们在读的描述句。
基本上我们不会事后拆解啦，通常
应该会只存一种来再合，还是两种同时存？啊？它会同时两种都存，那不就变？但是运行应该是用一种模式。它背景的那些资料的那个的结构应该还是算不错。
这跟你一开始 design 有点关系啦，就是这跟 IT 人员当初在开资料结构的时候会比较相关的。那你说背后哦？
不过其实我在设计命题应该是要从那个角度。
以电脑来说，你每一个 column 的 concept 越简单越好啊。你把它 concept， 因为对我们来说，你的 concept 假设是混合的东西的时候，那个它没办法很好的做理解。那假设你把它切割的很细的时候，它可以针对某个 column 做 index， 那就可以比较有效率啊。比如说 dry weight 跟那个什么 weight 这样，那假设你有把 weight 独立出来的时候，那比如说它就可以针对都是 weight 的地方做搜寻，那做 index 的时候会比较有利啊。所以就电脑在执行效能，以电脑的理解来说是它的 concept 是越 拆的越细致越好，因为假设你一个 column 里面有复杂的 concept 的时候，电脑的 query language 就复杂了，因为你 dry wet 或者是 wet dry， 这就是一个 problem 了。不早点跟我提醒我这个，因为我是也不是就对，我们开刀就有点都习惯，就一路下来我都忘记。对啊，其实我上完3个小时我也是觉得很累的。对，
刚才是说那个，现在这是第2年的博士嘛，然后好像上了这一堂课，比较能够了解一些概念。
对，对。我这个题目是比较dry，这个只有真的有实际在弄的人，我老板是这么讲的，给你们上课是给你们有一点 idea， 然后听完你们又会忘记，就会觉得很混淆啊，然后就要再经历过这样的东西2、3次之后，然后下次再真的遇到问题，你就大概知道我在说什么。
遇到再来找。
对，就是我就像你刚刚讲的，好像我跟你讲，好像刚刚呢。按过就随时老师又供起来听我，我很了解，我这个听我老板讲3次，我也是那个有些时候久没讲，我还要再看一下，我要记一下，不然重新再讲。不过这个其实因为这些东西，因为资料的表现，Jiang just told me that you said we don't have the break. For this guy, yeah, okay, yeah. Please remind me anytime. I mean, because I'm a surgeon, so sometimes when I will going up to the table, I just so I keep. But I hope we can do a relaxed style. Yeah, actually, Jian just remind me that you mentioned that this class we don't have the break. Yeah, but yeah. Please, yeah, sorry, that's my fault.
It's okay.
Yeah, because but all of you are very concentrate and pay attention to this class. Yeah, we have a very good discussion. Yeah, but remind me for anything we can adjust. Okay. Yeah.
It's okay if I just go to the restroom. I just go to the restroom.
Yeah. But I think 1:30. 90 minutes is kind of good limitation for the brain. I think 90 minutes. I think the next time remind me that for 90 minutes we can have a short break. Yeah, then we can have some break then, because for this kind of discussion it's kind of dry. So if you just to take actually I remember when I taking this class in Utah. I think it's 90 minutes. Yeah, actually 3 hours is kind of long. I mean, especially though thing is kind of a little bit dry topic. So for you, it's kind of I know the feeling. Yeah, sometimes.
Actually, I enjoy it because I get a lot of information from this course. Because sometimes another teacher, sometimes they have something like we need to present something, so it's look like a seminar course, not like that's why. And I just feel I didn't get anything that I need to find by myself and explain, and I don't know it's right or wrong.
I know sometimes. We call it garbage in, garbage out. I mean, it's just my boss teach me that way. He said I asked him to teach me the writing. He said just keep writing 100 times, then you will get better. I did it, but the result is garbage in, garbage out, because nobody tell me which way is. Nobody tell me you should do some planning or something like something. Because some people like Jack, he just too smart. Some people they got a talent on doing something, like singer. Some people they just can sing a song. So you ask him, how you sing a song like that? They say, okay, I don't know. I just sing. Just keep singing. So so that's something. Another thing give you the experience that if you have a question, don't ask the question. If you have a specific question, you can ask the smart guy. But if you have some experience or some critical thing, don't ask the guy from Too Smart, because he just said, I don't know, just do it. Then after I go to the Utah, taking the writing class, then we have a lot. The writing class is very interesting because the teacher, we will have a textbook, then we write something, then the teacher will give us some feedback and idea. Then they also encourage you to asking the question. And for example, I asked the teacher, say, I got a problem because I write a lot of sentence. Then after a couple of days, I come back and read it. Then actually myself, I cannot follow my idea. I don't know what I'm writing about. But I guess you have the same question. Then checked, he never told me about this. And just sometime I learned something from the class, and I said, oh, I think there's, for example, English, they got a thing they call end focus. They want the result or the idea you want to present put in the end of at the end of the sentence. Or then I talked to Jack, he said, oh yeah, that's right. I know that before. Okay, that's just they happen again. Just some people, they just got that talent, so doing that. Yeah. Then so I can imagine, just if the teacher they give you some tutorial and just ask you to present it. Actually, you don't need to come to class. You can just read on your own. Yeah. So, but I guess the difference of I'm taking this class is because I was trained by my boss, and we have weekly conversation, and those thing is more philosophy thing, a little bit philosophy. So we will have a lot of discussion. Then maybe because I'm struggling on writing paper before, so I know there are something I learned during this training. So there are something I will emphasize it because I just learned it during my PhD training. So yeah, that might can give you some my thinking process that can help you to in the future study. Yeah. So, but yeah, I'm glad that we can discussion. Then we can help to shape the idea. But I think until right now, I think we already covered good enough the variety of different CDS system. Then we got a reminder. We have some information management, focusing attention. Yeah, we have so on the different kind of systems. So I think you already have enough background for this field. So then from the next course, we will start to the methodology part. So we will start to talking about like the logistic regression, the data mining, how you get the data. I think a little bit, I think it's more related. First, we will cover the data mining, the data transformation. And the second, we will talk about those classification thing to help you to compute data. So I think we already in the 1/3 of the class. Yeah. So yeah, so all of you, we need to come up with some data for doing the project. Maybe we can divide you into two groups. Yeah, I think 2 people get together, yeah, to finish project. Yeah, then the good thing is 2 things you can discuss with each other. Then yeah, so but we still got time. So, but if you here cannot get the data ready for the class, then I will prepare it. But the idea is to, yeah, you need to learn. If you in the future you got the data, then you can play with the data and at least do something, come up with something. Then in the future, when you start to launch your real data set, then you can have the ability. At least you will know what kind of tool you can use. Then, but I guess you will still have a lot of discussion in the future. Yeah, but I just give you some introduce about what kind of tool you can use. Okay. Yeah. So yeah, you are second year. Okay.
Yes.
Yeah. You almost finished the course, right? Okay. Did you already? When you need to do the proposal?
I can start in the last of the fourth semester.
So do you need to pass some qualification or something?
Yes, for the qualification, I need to finish the course, and also at least I need to publish twice. But to publication, maybe can change into the something like have oral presentation. And I still have one last year. Last semester I go to Europe. I joined the European Biomedical Environment, and so I need once again publication.
You mean that including? I remember there's 2 publications, right?
Yes.
But 2 publications is for graduation.
No, so 2 before qualification and 2 after qualification.
Oh, okay. Oh, so before the qualification is the.
But
I think it's the oral presentation. Just before the qualification is you need to do the conference presentation.
You can change to publication before qualification with the oral presentation. If you find any conference that indexed by PubMed or Medline, you can do the oral presentation, and it can count as the publication. One publication.
I would suggest start early because you can keep thinking again and again. But but JCMIT is a good start. Just start early. Otherwise, I mean, if you keep thinking, you just keep thinking.
Yes, because each conference it's open something like 6 or 3 months before the event, so you need to prepare before.
Usually about
wait from 2 months to get the results.
Usually 6 months before the deadline.
Yes,
I mean,
yes.
Yeah. So my suggestion, remember one, if you already decide your advisor, talk to him weekly. Really, I remember. I really suggest you that because don't hide from your advisor. Then because you need to talk to him every week, then you will make progress. Yeah, because I read the paper that was sent in our writing class. They do the intervention. They compare which group of scholar researcher can write more paper. Then the best one is there is a supervisor. They check the researcher daily, and then you will know like the weekly and the monthly and on your own. Then there's a significant difference that's why sometimes when you do the exercise, it's better there's a trainee, the trainer to help you to do it. Yeah, because all the people we just get lazy. Just yeah. So I remember when back to the Utah, every Monday morning I need to talk to my boss. So every Saturday and Sunday I get nervous because I need to come up with something to talk to my boss. Then or sometimes he will ask me questions, something like that. So then for me the weekend is the Monday morning. After the Monday morning. So after the Monday morning, I got a very big relax because okay, my boss said great, yeah, something like that. Then, yeah, but always sometimes when I prepare something to ask my boss, then actually that is a progress. And
so read a paper maybe one a day, one article, or maybe
actually read more is better. If you don't have things start yet, I encourage you to read more paper.
Okay.
Because why? Because that's something you don't have right now. What's the difference between you and me is I don't think there's anything that is hard enough that you can understand. I can understand. You cannot understand. But we still have different. Just that sometimes I'm thinking about what's the problem between me and my professor. I think everything I can understand. I mean after he's so actually we are saying that what we are doing for the PhD training, actually we are connecting the dot. Because for each dot, you can easily understand. For example, today, I think I give you a slide. You can go back to read on your own. You can get all the idea. So each dot you can understand. But the problem is, I think when I imagine the part, because my boss, he always can give a very hyper view of the all concept and tell me all the rationale and explain the all why this and become this. So he got the idea connecting those stuff. So that's why, because I was trained on this way. So when you write in the paper, the most important thing is the rationale. So I'm not sure whether you have the part. During my master, I start to writing my thesis or start writing my first paper. Actually, I don't have idea how to write a paper. Did you know how to write a paper?
I just got something like follow the course about scientific writing, and I already published some paper, but in my language and just in the national journal. So I'm not sure is it the same way or not for the international paper.
I think it's actually so I still remember the first time I read the paper I asked Jack, but at that time he tell me so not garbage, not just right. He say usually when you actually that's another story. When I was in Utah, one of my senior he got two sons. One is around 10 years something. So he sent to the elementary school. Then one day he told me one story that his son, one I think is the bigger brother. One day the scientific class, the teacher asked them to do some little experiment. Then they asked them to do it at home. Then they need to present it. So his son, he just he liked to play computer like his father. So he used the computer software. They use a program to print a poster image. So they got a photo. Then they use the A4 paper to print a lot of picture. Then assemble it, become a poster. And so he think that is quite cool that because he can use the photo processing application and can use the printer for his age. And then he got to present in the class. Then actually, he got a very low grade. Then another his classmate, they just do some little thing, but it's truly an experiment that then they compare the different. Then my senior, he explained to me that the teacher said that that the goal of that class is the problem solving. So first, you need to identify a significant problem in your daily life. Then you need to propose a method to improve it. And then you fix it. Then you need to describe how well you fix it. Then I was totally surprised that that's why the difference, that because nobody told me before my master training. But that's why the American, those people, they are good because they train this since elementary school. I guess in Europe they did a similar thing. Like I remember for the in France for entering the college, they got a test for philosophy. They have a test for philosophy. They have two questions. Then you need to have some judges by that's kind of thing. That's I submitted one paper to a German journal. The editor, they are very strict to the philosophy or the rationale. When you write something, they can just easily point out one weak point. Say, oh, you just mentioned this in the middle of this, but in the beginning, in the introduction, you didn't have any introduction, and you also don't have discussion of it. Why you put it here? That actually usually is something weak point. I mean, you just observe something. You think that is something interesting, but you don't know why and you don't know how. You just put it there. But for those reviewers, they are very strict to philosophy, so they can easily actually after my scientific writing class, then I go back to read the paper. Actually, the how to write a paper is not a freestyle. Actually, there is a rule. They usually go back to the way. Then the first time I asked Jack how to write a paper. So usually the idea is you need to have the background. You have to, like the play a movie. You need to set up the scene, like the what kind of role player and thing. So you need to describe a thing. Then for the research, usually you have a difficult problem, right? There are something like for you, the accidentally, how to reduce the accidentally education is a difficult problem. And then you need to explain it. You need to persuade people, convince people that that is a significant problem. If that is something trivial, for example, there's no harmful for people accidentally education, then it's just fine. I mean, there's not necessary doing that. So you need to review the paper, tell people what people already done. Then you need to say how it's significant to improve the patient care. Then there is no other people having an efficient way to solve it. Then you propose your method to, I say, for example, I say, for example, like a reminder system can reduce, or for example, I put a red flag. There is a high risk for accidentally education. I say that I propose this. Then that's my proposed method. Then the result, then you will, when you're writing a proposal, there is a section called anticipate result. So because I hope I implement this system, then my anticipated result is I hope I can reduce the accidental attribution rate from 0.01 to 0.05. I want to reduce half of the accidental attribution rate. So that's, yeah. So in your proposal, you will have the anticipated difficulty. You need to address, say, oh, they have some problem, blah, 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 blah. Yeah, so on. Yeah, so yeah, so when you read the paper, that's something you need to learn. Okay, so I will encourage you to read more paper is because all the knowledge for you is not too hard, but for you in the future, if you need to write a paper, usually you will. It's hard for you to come up the whole story. Mm-hmm. So that's yeah. It is true that there is a period I don't really have a very clear goal. I'm doing what. Then my progress is kind of slowly. I read a lot of paper, mm-hmm. and it did help that something actually, especially in my last paper, is I come up with something. Then just I try to explain something in a systematic way, but I just don't know how to describe it. Then one day just come in my mind is I read one paper before, then I use that. Yeah, sometimes just when we write paper, finally we will use the top-down approach. Then you will have a very clear goal, and but in the true practice is bottom up. You always do a lot of small thing, but you don't know what you are doing. So we always say that if you can use one sentence to describe your research, then you are closing the end. Yeah. So yeah. Today I talked to Annie. He just she's in the late stage of for graduation. Yeah, I think she described a lot of his progress, but just she didn't come up with one sentence to but you can ask yourself, like, if you are closing the end, then at that time you can use one sentence to describe. Actually, I heard that in Taiwan. Then back to when I I went to Utah. I also have the same word. One of my senior, he just struggling on graduation. So I worked through with him during that period. Then I remember this one time his boss asked him, can you use one sentence to say what you are doing for your PhD work? Then my senior, he just then he said closer, but yeah, if you can say that in one sentence, you will. Yeah. So don't be too frustrated. So I mean, when you don't know how to do, or you don't know how to represent it or something, that's very common way. If you right now already can say something, I want to do this, then you don't need to do the research. So only after you explore all the territory, then you come up with something. Then that is the PhD or master learning. So don't be. But so again, find a good giant. That's very important. Like my boss, he's just like this, and he know everything. So at the very beginning, actually, he's already told me that sentence. Just I cannot understand it. So yeah, so find a good mentor. That's very important. Yeah, that will save you lots of time. Yeah, because but most important thing is stick with your boss. And another thing is set a time limit. Yeah, especially the who already have work. Yeah, set up the time. Wait.我林明景，你是要找谁？好。
每个礼拜问对方进度。
今天不是我值班的。
你可以增加那个。
你 call 今天，你看一线还，你 call 一下我一线好吧？好 ，OK， 好，拜拜。Yeah, so but that for this class we just stick with the project. But if in the future you have any question, because I have been this field for a long time, and I'm not like Jack. I'm not too talented, so I guess what difficulty you encounter, I must be passed before. So I can give you some suggestion. Yeah. So yeah, in the future, you have any question, just email me or anytime. Or if you have in the paper, you like me to give you some comment. Yeah, I would like to help you. Yeah.